looking at, instead of listening to this time, Whittemore Magazine Community Our Power, right here on Facebook. And we want to welcome all of our viewers and especially our guests. As you can see, we're live streaming. This is a special occasion here. But before we begin our show today, let's just want to maintain our continuation of showing appreciation to our jurisdictions that we serve locally, and sending out a shout out. We used to call it a shout out, but our condolences and our well wishes to people out there in Allentown, Burgess, Homewood, North Myrtle Beach,
Green Sea. Yeah.
For those of you who are looking at us nationally and internationally, I mean, these are just some of our local counties that we used to shout out to that had access to our radio program. However, we now, of course, you can see we are on Facebook, so Facebook is universal. So we continue with North Myrtle Beach, Santee, Homewood, Cochran, St. Paul. And I need some help from you guys if you want to.
No, you seem to have taken over, so we were going to let you have it.
No, I think look, Doc knows everybody. So,
yeah. How about Socastine, Wampee, Merle,
Loans. Yeah, we want to show our appreciation.
The Hill in Conway.
Lord,
he said the Hill in Conway.
Sugar Hill.
Sugar Hill, of course. Capital Conway.
Yeah. Yeah, we are located in Conway. Beautiful downtown Conway.
Yes.
Green Sea, Nixonville, Upper Georgetown, Lower Georgetown, Sandridge, Sugar Hill. We get back to Sugar Hill.
Aner, Marion County. If you are watching,
if you're watching, Falls Island.
If you're watching right now, please drop your location in the comment box so that we can give you a shout out during the broadcast. We do appreciate you watching us today.
And look, yes. To our listeners, it would be remiss if I didn't give a whole lot of shouting out to I'm going to call her our engineer. She's the co-host, but she's also, she should have gone to engineering school. I mean, I think she's had a little bit of engineering. She could corral all this stuff, this technology, and we're hoping that everybody can catch on. Even Joe Sixpack out there eventually. To listen to what all we have to say with people like Dr. McIver, Reverend Miller, Reverend McCray, and so forth. And we just want the community to know what kind of people we have in the community that are concerned about our well-being. Okay, so and we're starting off today with Reverend Tim McCray and Dr. McIver and Reverend William Miller of Bethel Missionary. No.
Get it right. Before we get into that, I want to say welcome Tanya Jones from New York and Connie Manigo, Carolina Forest. Thank you for representing. Remember, let us know. Carlos Parker from Conway. Thank you so much for viewing today. Let us know where you are viewing from, and we will definitely give you a shout out. And please share this so that everyone can see this important information.
Absolutely.
All right.
So April, we with our guest today, would you like to start off and ask for an introduction, I guess, or whatever your pursuit may be?
Absolutely. Of course, we have three of Conway's finest, well, two of Conway's finest and one of Myrtle Beach's finest, and we welcome them today to share some information. Our topic today, the need to alert, advise, and educate at-risk ethnic groups on COVID-19 dangers. We have Timothy McCray, who's with the South Carolina Commission on Minority Affairs, of course, Dr. Winston McIver Jr., Waccamaw Primary Care, and Reverend William Miller of Bethel AME Church. And we do welcome all three of you here today. This information that we're bringing to you today is all about the insights that are a part of the data that has been collected by DHEC and also the that's shared or disseminated by the South Carolina Commission for Minority Affairs, and also research conducted by Dr. Winston McIver. And we just wanted to make sure that we are using this time to place particular emphasis on how the virus affects the 5 major ethnic groups, but in particularly the African American or Black community. So that's going to be the topic today. We'll talk about some of the main points that relate to the data. And so at this time, I'm going to ask, well, I'll put the first question out there that's a part of our talking points for today. Dr. McIver, you typically give us updates on what's going on with COVID. So as of today, of the confirmed cases, can you tell us how many are minorities and also how many of those deaths are minority deaths? You're muted, Dr. McIver.
Let me first start off by saying this. Thank you again for having me. Right now, out of the roughly 1 million documented positive cases, only about 40% of these cases are broken down by race. Okay, so only about 40% of the cases are broken down by race nationwide. Last week, some of the Democrats tried to introduce some legislation to have the government, particularly the CDC, publish daily data to include deaths broken down by race. So right now, the numbers that we're given nationwide are only about less than 40% of the deaths. So we still don't know exactly how many, but we do know in some of the cities, some of the urban, more metropolitan cities, the numbers have been significantly high and significantly disproportionate. At one point in time in New Orleans, up to 70% of the cases were African American. Chicago, likewise. And in Milwaukee, Wisconsin, where only 27% of the population are Black, 81% of the deaths were African Americans. So still, there's a lot more information that needs to be gathered to have a full picture of how many of these are African Americans and other minority groups nationwide. In South Carolina, 54% of the cases are white, 43% are African Americans, but the deaths are just the opposite. So around 54% of the deaths are African Americans and 43% are whites. Whereas in the population of South Carolina, only 27% of the population are African Americans. So it's a unique thing where you're seeing one segment of people that are being more testing positive, but another segment of people are dying. Now, a lot in stats and numbers can be interpreted in a number of different ways. Is it that there are more positive cases in white folks because they're getting tested more? I mean, that certainly could be it. We know certainly in some of the rural areas in South Carolina, where we have a number of African American folks, haven't been tested. I mean, when you talk about South Carolina, 10 of the 46 counties don't even have a hospital. Mm-hmm. And out of
or clinics?
Well, they have some clinics, but they're still considered medical deserts. In other words, they have to go a ways to get some medical care. In South Carolina, 7 of the 10 counties that are predominantly African American are in the upper half of positive cases. So it's definitely disparity there, and we can get into a little bit later as to why there's disparities, but there are there nonetheless. Just a few more stats, and then I'll kind of be quiet for a minute. The average age of the cases in South Carolina is 51 years old. 40% of the people are between 50 and 70. 40% of the people are between 50 and 70.
And this is cases, Dr. McIver?
This is cases.
Okay.
Right, of the cases. Since Friday, South Carolina has had about 600 more positive cases. And since Friday, there's been 20 more deaths since Friday. Now, again, I have to say this. All these numbers are off. All these numbers are skewed because less than 1% of the population in South Carolina has been tested.
Wow. So we don't know what to expect.
Right.
Okay.
There's 5.3 million people in South Carolina. There's been less than 50,000 tests.
So, Brother Tim, your work with the South Carolina Commission for Minority Affairs, tell us how what you know, I guess, aligns with what Dr. McIver just told us in terms of his research.
Thank you, April, and Brother everyone for having me on. Definitely what Dr. McIver is saying is so true. We been on a conference call on Friday with South Carolina Commission on Minority Affairs. We are been in existence since 1993. We are the catalyst organization for the state, and we work with all ethnic groups: African American, Native American, Latino, Asian American, and we talk about these communities, and we work with different partnerships, and we work with DHAP. We was on a conference call on Friday with the faith-based, and Dr. Bell, she gave those same numbers with 27% of the population of African Americans here, and 36% has been diagnosed as the cases, as Dr. McIver has identified. And again, 57% cases, 55 to 57% have been of death of African Americans here in South Carolina. And that's a sounding alarm for us. And what we at the Commission on Minority Affairs been doing is trying to reach out to the community, as you guys been doing, April, alert, advise, and educate. That's our whole platform, is how do we go into alert and advise and educate? As Dr. McIver say, in these other counties, these rural counties, as Lee County is one of our hot counties in the state. I cover the PD area. And so I cover about 12 counties. We have the Midland, we have the upstate, and there was some other people in my office cover those areas. But our main focus is the PD area, and that's one of our counties, is Lee County and Kershaw County, and even in Marlborough County. These are the counties that doesn't have healthcare facilities and haven't been tested. And these are the hot counties right now. And so we're seeing those results. And our job is at the Commission on Minority Affairs, as a community outreach coordinator for the commission, is going to these communities, these rural communities, and begin to alert, advise, and educate our community about this COVID-19.
Okay, so what do we know about the top ethnic groups that are being impacted? What are the top 5 ethnic groups?
Well, the top 5 is Native American, African American, Native American. Then you have Caucasian, then Asian Americans that's being targeted right now.
Okay, can you say that again, please?
Is Hispanics, Native, then you have African American, Native American, and then you have Caucasian, and then you have Asian.
Right.
Okay, all right. So, Dr. Mack, a few of the comments that are coming in, and even for Tim as well, and of course, Reverend Miller, please feel free to chime in as you wish. The viewers are interested in knowing, about the emphasis on Black Americans and the percent of underlying conditions contributing to these numbers. So what would you all say are first of all, the underlying conditions that contribute, and then also, why this percentage is so high with us?
I think April, I think the 3 main reasons: poverty, access to health care, and education. Just to briefly touch on it, like Brother McCray, Reverend McCray said, when you look at the poverty line in the United States, 25% of African Americans are considered to, 25% of Native Americans are considered to be in poverty. 21% of African Americans are considered to be in poverty. 18% Hispanics, 10% white, and 10% Asian. So when you look at all the areas that you're looking at, poverty plays a huge role in that. For example, in Richland County, African Americans make up 58% of those living in poverty. And what happens is, when you look at it, that one of the studies that I read said that 95% of the riders of public transportation in Richland County are African Americans. 95%. So if you imagine getting on a public bus, no mask, no kind of protection, people coughing, sneezing, touching seats, touching rails, it's a prime setup. And that's a real big reason why this thing took off, and one of the reasons why it took off and exploded in New York City. Most people in New York don't drive. Most people ride the iron horse. They ride the subway. So that's one of the things that, you know, you definitely have to take into consideration is poverty. The second thing is access to healthcare. Like I said earlier, we consider these areas medical deserts. There's 46 counties in South Carolina, 46. 10 of them don't have hospitals. The majority of those people who live in those 10 counties have to drive at least 30 miles to a hospital to get adequate health care. So, and in 15 of the counties have hospitals that have fewer than 100 beds. So a large percentage of them have small hospitals that have it. So that's a setup for some problems. You know, the problem is that the death rates when compared to African Americans are 2.5 times higher risk than Asians to die from COVID, 3.5 times higher than Latinos, and 3.6 times higher than whites. For example, in Michigan, African Americans make up 14% of that state's population. Almost 50% of the deaths are African Americans in Michigan. Mm. So, you know, you're looking at this, and even in the reservations, particularly the Navajo reservations, have serious problems going on. And so, you know, it's an education, a medical desert, access to healthcare. And then the third thing is education. I mean, you know, educating folks that, you know, look, this stuff is real. You can't go out and hang out and have parties and all this kind of stuff when you got people that are dying. And education that, look, you know, even though there's some distrust of the government, even there's been some things that have been done that have not been cool, it's still, you know, this is real. And whether we talk about, you know, whatever theories that are out there, people are dying. And that's what physicians are worried about. We've got a number of physicians that are dying. And so when that happens, knowing what it takes to get to that level and how much sacrifice is being there, and then you seeing people die because they're trying to do what they're trained to do, it's disheartening. And for a lot of physicians, it's very, very troublesome, worrisome, and it's bad.
Reverend Miller, I know you want to chime in on this because we were talking about this the other day during the prep call. Yeah. What are your thoughts on it?
Right. So I'd like to thank you for the invitation to be on. I certainly want to piggyback on something that I just heard Dr. McIver say, and that is as a community, making sure that we're seeking out trusted sources of information. But you know, I was reading an article, I think in the New York Times, and it was they were talking to a number of doctors who had mentioned how they had seen the appointments, in-person appointments decrease for people with small children, people who were scheduled to get vaccinations. And I think that's one of the unintended consequences of what's going on right now. As he said, we know their discussions, and they happen in the public sphere, they happen in our private homes, but there are a number of conversations that happen about reasons for mistrust of institutions for one reason or another. But one of the unintended consequences of this is there are other things that children get vaccines for, mumps, measles, that they're not getting. And so when you think about a public health crisis, it only exacerbates the public health crisis when they're not getting the other basic services that we traditionally get during a time like this. I think in our conversation, me and I were speaking, we talked a little bit about some of the, I don't want to call it confusion, but I think some of the controversy around our ability to police ourselves. And so when we compare institutions and the messages that come from institutions versus the messages that come from within the community itself, I think all of us have probably seen the picture circulating about the young adults who had the house party in Chicago. Mm-hmm. And I think the numbers, the estimated number of somewhere of 1,000. And what's strange is we've laughed about the memes about the mayor of Chicago for the last 2 or 3 weeks. You've probably seen them on Facebook. And so with Mayor Lightfoot from Chicago, and here in the very same city, where the mayor has taken a public stance about the importance of observing some of the restrictions that have come out. We have young people who are so eager to get out the house that they crammed into a house just to socialize and to catch up with one another. And so I think it's vitally important for us to have trusted conversations as a community about the information that's coming out, how we can put it into practice, even how we can critically think through it, and maybe kind of get to some truth at the bottom of everything that we're processing.
Absolutely.
After listening to all this, these statistics, man, they're really stand out. Okay, especially coming from you, Doc, and all the both of you also. I tend to want to get the type of information that we can't really make a judgment on yet. And when the doc, you said 1%, you use something like 1%. I'm hungry for the information, and I guess time has to come into this. Maybe in the next week or so, or 2 weeks, or in the very near future, I could say, that would give us something more to stand on, and that we could perhaps, as a community, start thinking about a solution to some of these things. Okay, now, like Reverend Miller says, that's something that we could start right now, and that is with some of our institutions, maybe our religious institutions can bring this to the forefront immediately and keep it on the forefront about socialization and just being careful and abiding by some of the national distances that's prohibited or that's been set out there as a standard now. And I'll come back later on, because I would like to ask everybody's opinion on what they think is going to be the outcome after of this, the impact of this virus so far, because I'm looking at a trend technologically that may impact us for a long time. Televideoing is one of those things that just may be with us for a long time. Okay, I want to, and I don't want to talk about maybe the future of education, of educating our children, because just really looking into the future, we might see something that they don't see a need to building any more structures for schools. There'll be a lot of televideoing and everything done by streaming. So I don't want to get off on a tangent on that, but I do want to kind of focus on what we could do now to address some of the issues that Reverend Miller said about socialization, and Reverend McCray, and of course Doc. So if anybody has any thoughts on that, or do you think that what we would be doing would be premature, then I'd like to hear your thoughts.
Well, I think that what we can do now is begin to what we're doing now, continue having these platforms, having these type of discussions in our community, because this is where people get their information at now. And then working with the faith community, having them to begin to understand the importance that they have to alert, they have to advise, and they have to educate. As Dr. McIver said, we're dealing with poverty, we're dealing with healthcare issues, we're dealing with education. And when we begin to look at how do we build a community partners in action, coalition, and building these community partners in action coalition, and talking to our hospitals, talking to our business community, our education institutions, and in our government relation groups, and talking to them about the concerns that we have in our community. But we need to begin to take the leadership in our community. That, as my brother was saying, that it's time for us to govern ourselves. And when we see these issues that's going on, even on social media, even as I walk in my community and seeing people still cooking out and hanging out and not wearing masks, and they're not aware of what's going on, or they feel like they're not aware. It's just like we're still at the same norm. And so we got to begin to educate our people and begin to help them understand that we are in a crisis. And like you say, we don't know when this thing is going to end, but we need to begin to educate our people in the different platforms that we're on. If you have your pastors or live screaming as they're doing their Sunday morning service, they need to be talking about, hey, social distance is very important. And I got to say it again, social distance is very important, because I lost 60 people in New York. And basically because of social distance. They wasn't social distance. They was going to church still. They was bishops have died in the Church of God in Christ. Leaders are dying. And people are just dying in our communities up there, basically because they're not practicing these social distance. And so my concern is, as here with South Carolina Commission on Minority Affairs, we're going into those rural communities and we get ready to educate. We get ready to talk about alerting and advising these communities through different platforms. We have our African American coordinator. She putting some information out there. We have our Latino coordinator director. He's contacting those communities, Native American, Asian American, and we're addressing some of these issues. And we begin to say, hey, guys, we got to come together and address some of these issues that face our community. And so I think that this is a great platform. Other platforms that Dr. McIver and Sister April have been doing on the network, bringing that information to our communities when it talks about this issue, talk about business mode, those opportunities that's out there. Yes, we're in a crisis, but there's a lot of different opportunities out there for our community, but it's up to us to take advantage of it.
Brother Tim, do you think that the best way to get into the rural communities is through the church? Is that going to be the...
That's not our best way. Is right now we're working with, like we did with United Way here, we're setting up food destinations, and then food destinations, we're going out there and we're handing out information. We're going to the Dollar General stores where people where people are meeting. We're going to them and we're handing them this information. We send them to our website to get the information. They go to CMASC.gov and they can see the information that's out there. But we're definitely out there in those communities, and we got to go in those communities because the churches is not out there. The church doors are shut, so we got to go out there and be the voice too.
Exactly.
So yeah, to Reverend Miller, you got your mute on. Okay. Are you having success, or do you streamline now from services on Sunday morning from Bethel?
We do broadcast on Sunday, but it goes at 9, and it's been fairly simple. I've had to kind of adjust our streaming format only because of some family challenges. My dad had a stroke in January, and so I've been going back and forth between Charleston and Conway, and so I've had to try to make some adjustments with how we broadcast. And I've try to limit the number of people that I've been around, only because I didn't want to bring anything back to him. But we've done that on Sunday mornings. I think it's varied in terms of the number of people we reach. But I think first week we broadcasted, we probably had about 1,700 hits. And so, we have seen some activity there. We have a weekly radio broadcast that's been ongoing. We've had that going on now since February of last year. But I think there are other ways the churches, even like ours, in a sense, have had to adjust. And we're still learning. The learning curve is very steep. But I think with each passing week, we've had to sort of make or learning to make adjustments in terms of what we offer. And so we'll be adding some more to it in the month of May, even though we're looking forward to going back to church. Some churches have done the conference call. Some churches have done Zoom. I've been on a lot of Zooms for our ordination process. I got 4 Zooms scheduled this week, and so it's a bit taxing and tiring. But in speaking to some people, I really think that. And speaking to some people, I really think that people are ready to get back to some sense of normalcy, but things are not going to be normal as they were, even after we come back out of the quarantine. And so whereas we might do Bible study via conference call line, which we've done, I think it is important people to understand whether it is continuing with the social distancing through however long, whether it's the end of the year. I think we are going to have to look at how things are going to be different, at least for the present time. I think one of the challenges for us as a people is the fact that we are extremely social people. It's just the nature of who we are.
Right.
When you think about the African American community, or the minority community for that matter, when you think about the Hispanic or the Latino communities, they're social people. We are extremely social people. Whether we're entering cookout season, we're accustomed to having cookouts this time of the year, graduation parties at graduations. And so we're going to have to look at the way that we socialize. I don't want to take up too much time, but I do want to kind of lift up and highlight something that the Reverend McCray had said, and something that you hit on, Brother McQueen, and that is, looking at the ways that we find synergy amongst our community partners. And so as the religious institution or as the church, we know that people come to the churches, they go to the mosque, they go to the temple for religious direction, but for a long time. And I think it has a lot to do, in a sense, with a very Western approach to our religion and Christianity, if you're a Christian. And that is separating the body from the other aspects of us. And so as the church, if Dr. McIver gives you some information that's supposed to help you be better, be health-wise, and it's supposed to help improve your mood and your emotion, as the church, it is vitally important for us to make that connect with the scriptures. Not because, we're kowtowing in a sense, but because, we can look at scriptures and see where, Jesus ate, slept, meditated, and we could find pronounced examples of that. Where Reverend McCray is working with the Division of Minority Affairs, when he talks about economic development, we talk about spending within our communities and buying Black and supporting our businesses. When I came to Conway 5 years ago, the first thing that people told me, Councilman Larry White, he's a steward at Bethel. He came by the house one day, knocked on the door and said, "Hey, Reb, come on, get in the car. Let's ride around. Let me show you the community." So we're riding around, and he's explaining to me about Conway and how in Conway at one point, just on the race path, both sides of 378, you had hotels, you had restaurants, barbershop. I mean, you had all of this within that community. Laundry, yeah.
Dry cleaners, man.
And so, yeah, it was there in the community. And so, that's the one thing that I've really been proud of about your community in Conway, is the fact that the communal memory is long, and people can point out to you and tell you where this was and where that was, and how the community was really a thriving community in and of itself.
All right. Speaking of community, I do want to give a shout out to some of the viewers. Thank you so much, who are all tuning in via Facebook. Marie Lanier from Myrtle Beach, Rose Vereen from Conway, Miranda Sherman from Fort Lauderdale, Florida, Michelle Johnson Singleton from Conway. Thank you so much. Courtney Sessions, again, New York. We appreciate all of you tuning in today. And of course, we're talking about the COVID-19 impact on the top 5 ethnic groups and what we can do to alert, advise, and educate these at-risk ethnic groups, so that we're all informed of not only what we need to do now, but the consequences if we do not step up and take full advantage of opportunities, but also if we're not mindful of the data and the numbers that show how our communities are affected the most. So one of the things that we were going to talk about today as well is all centered around the current or pre-existing health conditions and what role these conditions play in whether or not you will be affected by the virus. And I know Dr. McIver can touch upon this. And then Tim McCray, if you can talk to us about what's being done to make sure that people are aware of these conditions and the fact that they are, definitely high risk or more at risk because of these medical conditions. So Dr. McIver, what are those pre-existing or current health conditions that puts us at risk?
Well, primarily chronic health conditions such as uncontrolled diabetes, asthma, emphysema, bronchitis, cancer, any other kind of condition that can lower or weaken your immune system. But let me say this too. Over the last week, there's been kind of a trend that's been kind of seen with some of these patients presenting with that were COVID positive. And there's 6 new symptoms that have been listed to the group of symptoms that we see with patients that have COVID-19. Chills, repeated shaking with chills, muscle pain, headaches, sore throat, and loss of taste and smell have been added to the list of common symptoms that patients with COVID-19 would have. Now, certainly you don't have to have all these symptoms, but there have just been some that have been seen. But probably one of the most interesting things that's been happening over the last 3 to 4 weeks is seeing patients, particularly younger patients, show up at these hospitals having strokes. So let's talk about that for a second.
Yeah, please. Yeah.
Let's talk about that for a second. We talked a little bit in some previous talks about the heart attacks, talk about COVID tolls. When people talking about the tolls, I'm sure people have seen that on Facebook. And now the strokes. What's happening is there's a kind of a series or a cascade of things that happen in the bloodstream that cause this to happen. Number one, when you're having this COVID-19, it's creating a lot of inflammation inside of the blood vessels. Okay, the inflammation disrupts the normal flow of the cells within the blood vessels, particularly the red blood cells. The disruption in the flow causes decreased flow to these organs, hence decreased blood flow to the heart attacks, decreased blood flow to the kidneys, kidney failure needing dialysis, decreased blood flow to the brain, stroke. But what else is happening is we're seeing that these organs are having these issues, and it's called a large vessel disease is what it's called, where these larger blood vessels, which carry the blood flow to those organs are being significantly affected. Now, an interesting thing, down at MUSC, they published some data that I was looking at. Is saying that their stroke unit, and they have one of the largest stroke units in South Carolina, is down 35 to 50% from what they would normally see. Now it's not because people are having less strokes, it's that a lot of these people just are afraid to go to the hospital. And so what's happening is when you see those numbers dropping down, you get concerned because people just not going to stop having strokes. So, and there's certain medicines that you can give for heart attacks and strokes that are time-sensitive medicines. If you don't get to that hospital within 4 to 6 hours, you lose the window of opportunity to use those clot-busting medicines to prevent major damage. So on one hand, we're seeing that happen, but on the other hand, we're seeing a lot of these young folks who are coming in, ending up on dialysis and ending up having strokes. Now, some of it is because they've waited long, but other things is just this inflammatory process that I was just talking about. That's something that's being seen.
So, you didn't mention anything about diet, as to, of course, I didn't ask about the cause of some of the causes that you.
I had an interesting conversation with a group chat that I'm in on Facebook, and diet was one of the things that came up. Diet is a factor in this. It's like an equation, and to solve an equation, it's multiple variables that are involved. Diet is one of the variables. Education is one. Access to healthcare is one. So there are different factors that are involved, because not everybody who eats a bad diet has bad health. So it can't be all diet. And that's the kind of conversation that I was having with this other person, although diet does play a part in it, which gets back to poverty. I mean, if you can go and you can buy some French fries for 99 cents at McDonald's, but the salad costs $3. There it is. There it is. So that's part of it. The other thing that I read too about diet is for a person to have a healthy diet, and this study was done by Johns Hopkins. and actually Harvard reproduced it too, is that for a person to eat a healthy diet, it costs them between $2 to $3 more a day. You're talking about $700-800 a year.
Mm-hmm.
It doesn't sound like a lot, but if you've got a person that's making $12,000 a year, that's a lot.
That's right. Mm-hmm.
So I have them in the office that, you know, have to decide whether they're going to get their medicines this month or whether they're going to pay their bills this month.
Mm-hmm.
And that's real. That's real life. So yes, diet does play a role in it, but it's just a part of the equation.
Mm-hmm.
Okay, let me just ask something.
Important part.
Yeah, major part. And if you're not comfortable about talking about this, then we'll go on to something else. But how do you think Obamacare would have played out in cases like that, and a lot of giving people access to a lot of preventive medicine and preventive office visits?
Well, that's huge, because not just Obamacare, but just expanding Medicaid. You know, when and I don't want to get too political on this.
Yeah,
When previous governor did not accept not expand Medicare, it knocked a lot of elderly people off. It knocked a lot of disabled people off. It knocked a lot of pregnant women off. It knocked a lot of kids off. And you know, I get people all the time that come in my office saying, Doc, you know, I got kicked off of Medicaid, and they told me I make $700 too much a year. And this person is making less than $25,000 a month, a year.
That's right.
They're making $700 too much a month, so that knocked them off of Medicaid. But they're only making $25,000 a year. So yes, Medicaid expansion, or the lack thereof in South Carolina, was huge. And that's a huge part to this, and that's a huge part to the access to healthcare.
Mm-hmm.
And I could see that as really impacting the statistics on poverty, persons of poverty, themselves dealing with the COVID virus.
Brother Edward, like I said, it's a part of the equation.
Yeah.
It's a variable in the equation. Yes, but I can go on about that for an hour. So.
Yeah, that's another show. Exactly.
That's another. When you brought up stroke, I thought about it.
Everybody got quiet when you brought up strokes. There's a question that's come into the thread. Someone asked, should we stop eating meat because of the COVID impacts on processing facilities? And I don't know if you have seen the latest reports, but I know there was something going on with the chicken processors, and you know, there've always been questions about whether or not it's safe to eat food if you're going out and things of that nature. So, Dr. McIver, can you add any or shed any light on what we should do?
It does raise concerns about that. However, there's been no proof that it's passed that way. So again, you know, I can only give it as it's given to the medical community.
Mm-hmm.
Some people are skeptical about some of those things, but as it relates to any proof, there's no proof that it's transmissible that way.
Exactly. So, Tim, I know that one of the things that you wanted to address was how can we bring organizations and community partners together to address these issues. So, you know, what are some things that you want the viewers to understand, especially if they happen to be organization or, you know, community leaders themselves? What do you want them to know?
Well, let them know that what we're doing at South Carolina Commission on Minority Affairs, again, we are alert, we're advising, and we educating our community partners. And we're asking them to reach out to us. Go on our social media and see that the same information that Dr. McIver is sharing today, we're putting that information out there on our social media and those different, our Facebook, our Twitter accounts, and going in our pages and bringing that information, because it's vital information that will change lives in our community. And you'll see on our page is a community survey that we put together, asking people for their needs. We need to hear from the community. We need to take a need assessment of the community and looking at, just as we talk about in those rural communities, how do we create these primary care centers, talking about healthcare. And even here in South Carolina, when we're going to talk about $60 billion is getting ready to come to our they get ready to pass for new primary care centers or treatment centers. We need to be at the table here in South Carolina saying to our governor, and which we're doing in the South Carolina Commission on Minority Affairs, that we're looking at different areas in the rural communities, and we're willing to partner up with our faith leaders, partner up with other community partners to begin to look at how can we create these primary care centers, because that's the need. And even with healthcare is a major issue. How do we lobby our legislators to see that this is a need that we need in our community? And so you will see those things that we're doing with South Carolina Commission on Minority Affairs, and we just seeking partners. We're seeking people out there who want us to get on board and address this issue that we're facing in our community, because it's not going away, guys, and we need to work together to begin to address these issues. For these numbers to come down, we got to have prevention and intervention, and we got to continue to listen to our doctors, like Dr. McIver, and saying, even when I was on the call on Friday, Dr. Bell was saying, listen, we haven't reached that curve yet. And no, we don't need to be social distancing. We don't need to be gathering at churches. We don't need to be going out to malls and shopping and stuff like that. And you're seeing, we don't need to open up this state right now. And we need to begin to figure out what are we going to do next. And we need to bring all our partners together to address this issue. Because when school come back, what are we doing to address those issues in our education institution? That's a major issue, and our kids are social. So how do we address that issue? When we talk about business partners, how do we look at, a lot of people going to have some hard times, but there's opportunities out there. I mean, how do we work together in doing joint ventures and begin to be creative? I'm seeing people right now, they're cooking out, they're selling crabs, and they're doing all types of stuff in our neighborhoods. And it's interesting to me, because now you're doing that. Maybe we could come together and address some issues that we could really make an impact, even in this crisis time that we're in.
One of the talking points as well today that I think we all wanted to address, and I'm going to give Reverend Miller a few minutes before he has to leave, the importance of following the recommendations for social engagement. Tim, you just touched upon that. And I think that now more than ever, we need to implore people to make sure that they are following the recommended guidelines, or, we don't need to see any more of what we witnessed in that video with the 1,000 plus people in the packed house having a party, or, we already know what's going on at funerals and other places. But, why is it especially important in our community that we do this? And also, why do you think there's so much resistance when it comes down to following these recommendations?
I think that's a great question. I think it's important for us to follow the guidelines, one, because I remember saying to some folks from the church that, I prayed a prayer, and my prayer was that we would all get through this as far as our community was concerned. And so I think it's important for us to follow the guidelines that are coming so that we can remain as safe as possible. I think Dr. McIver said it best. There's a lot that we know, and there's a lot that, as a medical doctor, he's getting. There's a lot that Reverend McCray, as Commissioner for Minority Affairs, is getting. But it's the stuff that we don't know. And so we're still learning about the coronavirus or COVID-19, it's imperative for us to be as cautious as possible. I think because we're social people, we often get offended if someone doesn't honor the way that we socialize. I see you, they didn't shake my hand, they didn't hug me, and I just saw them in church last Sunday, or I just saw them at Walmart, or wherever it was. But I think it's important to know that in this and out of this, that we're going to have to know that affection doesn't necessarily come across by me being able to hug you, but it's in the words that I use. It's in my body language. It's in the way that I communicate, and we're just going to have to know that we have voices like you, and like you, Sister Garn, Brother McQueen, and Dr. McIver and Reverend McCray, who I think are ingesting a lot of information to be sure that you're able to bring the people information that's going to help them and not harm them. And so as we go to our institutions that we really trust, whether it's school, whether it is a religious institution, whether it is our place of employment, it's vitally important for us to have these conversations and to continue in conversation even through the other side of this, because right now it's COVID-19, but in the fall we're looking at a very heavy hurricane season. And so we're going to have to potentially prepare for that as well. So I think if we stay sharp and remain sharp, it helps us to prepare for whatever it is that happens next.
Absolutely. Reverend Miller, thank you so much for joining us. I know that you needed to make a exit because you have another Zoom meeting to get to and you got to prepare for that. So, but we do appreciate you being here today. Thank you so much.
Thank you for the opportunity.
Yeah, thank you, Reverend.
It was a privilege.
Thank you. Come on, man. Really appreciate that.
Yeah, we'll have you back.
All right. Take care. Thank you.
All right.
Best regards to your father.
Thank you.
One other thing, April, the reason why it's important to follow these guidelines from a medical standpoint is that South Carolina is in the heart of the stroke belt, the hypertensive belt, the diabetes belt, and the heart attack belt. As a matter of fact, North Carolina, South Carolina, Georgia, Mississippi, Alabama, Louisiana are all a part of that, where the numbers of these chronic conditions that I just named are astronomically high. But not just the conditions, the manifestations of untreated conditions are high. Amputations, blindness. The number one cause of blindness in the United States is diabetes. The number one cause of dialysis in the United States in adults is diabetes. So in this belt that I just named, not only are those conditions rampant, but the conditions not being adequately treated are rampant. Now, there's a number of reasons why that is. Patients coming to see the doctor, seeing the doctor regularly, taking the medicines, access to getting to the doctor, just a number of reasons, a number of things. But that is the reason why, one of the main reasons why following these guidelines are so important. The second reason is if this pandemic follows suit like most other pandemics have done, there will be another peak of this 3 to 9 months after the flattening happens. That's just the nature of what pandemics do.
COVID-20.
Excuse me?
COVID-20.
Please don't create another one, Brother L.
No, it'll still be COVID-19. It'll be an extension of COVID-19.
That's right.
Like the Spanish flu lasted pretty much 2 years. I'm not saying this is going to last 2 years, but it took time. It took time. And the reason why a lot of that second peak happened and was much greater than the initial one was because people relaxed the restrictions too soon.
Right.
So again, that's what pandemics do. This is not going to be, to me, it's not a surprise. And I've said this before. It's not a surprise that this happened. This was going to happen. The surprise was that we weren't prepared for it. Yeah.
Are we talking about 100-year intervals for things like that, right?
No, I mean, in the last 100 years, we've had about 6 pandemics. In the last 250 years, it's been 10 of them.
Okay.
Pandemics are going to happen. Viruses change. Viruses do funky stuff. That's why we can't even find a cure for a common cold. So this happens. I'm not surprised that this happened. I study medical history. The question, the surprise was we weren't ready. That was the surprise. So this one is going to get better. People have recovered. People will continue to recover. But somebody asked me an interesting question. They said, well, why don't doctors talk about the recovery more? And the answer that I gave is that you still got doctors on the front line that's dealing with the condition. So until a condition looks like it's getting under control, that's when physicians will start emphasizing the recovery. It's not that it's not important, because it's very important. And I'm very glad to hear that people are recovering. But when people are still dying, especially colleagues of mine that are dying, that's what we're focusing on. How do we stop that?
Absolutely. Well, we have just a few minutes left. I want to definitely recognize our viewers. Thank you so much, Sabrina Hickman from Wilmington, North Carolina, for tuning in. And thank you for the work that you're doing on the front line. She's a nurse up in North Carolina, and we really do appreciate everything that you're doing. Definitely want to give a shout out to Eileen White and Conway. As a matter of fact, there's so many of you who have tuned in today and you've shared this. Thank you so much, Bonnie Edie, Shayna Scott, Deandra Weaver, everyone for listening in to us. And we're going to continue to bring you this great information. I'm going to let Brother Elward at the end of the show tell you who our guest is for next week. But before we leave in the next couple of minutes, we do want to leave you with some main takeaways from this discussion. What can we do as a community to combat the health issues that have led to a rapid rate of demise in our community? And also, thank you, Terry Alexander, for listening in. We do appreciate your work, sir. What are the things that we can do to continue to combat the health issues? But also, from this entire discussion, what do we want people to remember as they, over the next 24 hours, attempt to change their mindsets about how they're going to continue to deal with COVID-19? Brother Tim, you want to kick us off? You on mute.
You're on mute, Brother Tim.
I can probably come back in. Dr. McIver, you've already talked about all of the health issues and, basically what we can do. You're not saying by any means, as far as my interpretation, that if we start eating right tomorrow, it's going to make us immune to COVID-19. But I think what you are telling us is that, some of the health issues that are traditionally about our culture and that affect our ethnic group, those things need to be combated starting now. And so we need to start making strides towards better health so that if we have the next crisis, and that crisis will come, we'll be in a better position health-wise to deal with it. But from a community standpoint, again, main takeaways from this discussion as far as what we need to do moving into this week.
The main takeaways is just try to keep education, try to keep people informed with, sound, sound, truthful information as we know it. To have people to just understand the importance of this and understand that, 4 to 6 months from now, we're going to be back in cold and flu season. And that's a concern about it. Some of these myths, that heat is going to kill the virus and just to use common sense. And the other thing too is be good stewards of your community. If you're not worried about getting it, worry about your mother, your father, your grandparents, your aunt, your uncle. Worry about other people. Even if you're not concerned about you, think about other folks that may have some of these conditions, may have diabetes, high blood pressure, sickle cell, cancer patients, cancer survivors, all these people that may have conditions that work on their immune system. And it's really important for us to understand, because this is a part of the equation to not only help us get through COVID-19, but to help us when the next pandemic happens. And the silver lining that I try to find in this situation is maybe it will help people be more in tune with their health. Maybe it will help people understand the importance of taking your medicine. Maybe it'll understand the importance of, trying to eat right and trying to exercise and trying to do things that help build up your body, because that in turn will help your immune system.
Absolutely. Thank you. Brother Tim, your main takeaways from this discussion.
Something's going wrong with my sound system.
We can hear you. We can hear you good.
You're good. Yeah.
Well, I believe that if we as a community come together again, alert, advise, and educate our community about what's going on. Again, following what Dr. McIver is saying, we have to bring so much awareness in our community. And how do we sustain sustainability of our community, addressing these underlying issues? And so that's where we at. If I've taken away is how do we work together as a community, bringing community partners together to address these issues, and especially in the rural communities of South Carolina. We got to get out got to get out into those communities and begin to educate our people and begin to bring our partners together. If we cannot do this alone, we have to have partnerships, and we have to talk about integrated project delivery services. How do we bring these services together to make the impact in our community here in South Carolina, especially when it comes to the African American community?
Absolutely.
So thank you, guys.
Well, thank you, Brother Tim, for being here today to share the information from the South Carolina Commission for Minority Affairs, and of course, Dr. McIver, my partner in crime, delivering this information. And of course,
he always comes up with some good information.
Always, I'm telling you.
He goes back and then he goes back to college, man.
I appreciate it.
Yeah. That length of time. Then he comes back with us what he's gotten and all that kind of stuff. But I think not just us that appreciate you very much, but I'm sure our listening audience, our viewing audience now, really appreciate the statistic that you blurred out and all that information. Man, a couple of those things were new revelations for me, But I'd like to say that, and again, I'll thank our co-host, April. She has the capital of Conway. She's in the capital. Sugar
Hill in the house.
For those of you
if you're from Sugar Hill.
Yeah, for those of you who are international, those of you in Washington D.C., someplace, because we have some people looking from D.C. But Sugar Hill is the capital of Conway, South Carolina.
Yes, it is. All day, every day.
All day, every day. And they don't call it Sugar Hill for nothing. 2 words.
That's right. Sugar Hill. That's right.
But to conclude, I would like to just put a little strength on telling our viewers about distancing, social distancing. I think that is so critical. Okay, if you can just keep it in your mind when you go to some places. We don't want to stop you entirely from going to the grocery store or going to get your medicine or whatever. But when they have these lines that said 6 feet on their floors, please abide by them. And Reverend Tim mentioned the word unity. That is a must. Okay, we can fight this thing. We may not defeat it entirely, but I think we have the power to do so if we unify not just our resources but our thinking as one to deal with this virus. And who knows what may emanate from that if we're victorious in this unity. We see some good things come out of that. It's like we were saying, Reverend Miller came on and said that somebody was showing him about what Conway was like some time ago. That could be, again, we have that with unity, we will have that kind of power. And our viewers, thank you all for listening. For viewing this, and I hope you tune in. What, next Monday, Sister April?
Yes, next Monday. Tell them. You want me to tell them who we're going to have, or you want to?
Yeah, you can. But next time we didn't have a hard copy for the Whittemore Community Magazine this time, and it was due to the logistics that were rather unbearable in terms of getting it out because of the virus. Okay, and everybody was kind of like a standstill. So our printing was interrupted, and we just couldn't get them out in a timely manner. So, but we think we found a way to address that issue for our next the June issue. So stay tuned. And hopefully
the May issue. Oh,
the May issue, yes, the May issue, because this was the April.
I had a dial for every time. Yeah.
Yeah.
Yes. Well, that's
So-
great, but remind them that they can view the April issue on WCMagazine.net. Go to
Right.
WCMagazine.net.
Right.
Take a look at the April issue and also support our sponsors. And also for next week, next Monday, we're going to be doing Whittemore Community Magazine every Monday at 6 p.m. We're going to have James Paisley from the Waccamaw EOC. He's going to talk about the resources that Waccamaw EOC has available for people who are in need. So typically they assist with things such as helping to, pay certain bills. If you are coming up short, they have certain resources for employment and different things that are available to the public. So tune in next week. We will have James Paisley as our special guest, and he will talk about all of the resources that are available for those of you who, have some needs at this time.
Believe me, April, WEOC has a lot of resources, but that a lot of them the community hasn't heard about yet.
Yeah, I know.
Okay, and they're doing some things,
a lot of stuff. They are. Lots of things available. I also want to let you all know that this week on Wednesday at 5:30 p.m. we will have our talk with the young people in our community, the network live on Facebook at 5:30 on this coming Wednesday. There's 8 special guests from around our communities. They're all high school or college students, freshmen in college. And they're going to be talking to us about their perspectives on COVID-19. My special guest co-host will be Claudine Lance Schofield of Sound Off. And of course, as you know, she's an educator in Horry County. So it should be a wonderful show, lively discussion. We're going to hear from these young people and see what they have to say about what's going on. And also, we're going to dig deeper into some things that they feel the community can do to band together so that their future is bright. Because whether we are reminded every day or not, they're the ones who are really going to be dealing with a lot of these issues that we're talking about right now, as far as any other types of pandemics that are to come. We may see it in our lifetime. Maybe we won't, but these young people will definitely have to deal with some things. And so it's going to be great to see to listen to their perspectives. We have some young students from Horry County and from Marion County who are going to be joining us. So please make plans to tune in on Wednesday at 5:30 p.m. I'm going to broadcast it same way. And that is live with the network on Wednesday at 5:30. I'll be posting the promo later on this evening. So with that being said, Brother Edward, this was your first Whittemore Community Magazine virtual radio show. How you feel about it?
I feel great about it. I think it's far reaching, and it was part of our vision, some time ago when we thought this was feasible to do. So now it seems like it's coming into fruition, and I think we have a lot of things in store. Okay, don't we?
Yes, we do.
Okay, we have a lot of things in store that we're going to do on here, and we just want you to stay tuned, because you're going to see a lot of things that we've been in the planning stages. And some of you will be surprised, but we're going to follow through with it, and I hope you'll like it. So WCMagazine.net is our website page, and there you can see that, like April said, the latest issue of the community magazine, and see it through and through. Okay. And some of the old the videos of some of our past broadcasts. It's a lot on our webpage. Just go there, WCMagazine.net.
Awesome.
Okay.
Well, thank you all for viewing, and special shout out to Sister Joella if you're viewing. We appreciate you as well for being a part of this. The Queen Mother, Sister Joella. Thank you. Yeah, Mr. McQueen.
Doc always leaves me out, man. I can go to the office, man.
We absolutely love you. Thank you so much.
Doesn't want to address my issues, man. She's going straight to Joel.
That's right. Take care of the Queen. That's right. Take care of the Queen. Brother Timothy McCray, thank you so much for joining us today, and I hope you feel better.
Thank you.
All right.
Grateful.
Oh, absolutely. Always. So
right,
take care.
Tim.
Yes. Thank you all for tuning in, and God bless.
God bless.
Thank you.